Stay tuned for another exciting edition of Simply Your World. Thank you and welcome to my channel, Simply Your World, where we discuss past and present events that will affect you if they haven't already. If at any point you find this video interesting, please hit the like and subscribe button, and don't forget to hit the bell so you can receive all notifications as I post them. And if this is your first time to my channel, I want to say thank you. And if you've been here before, you know I do not like to speak too long before I actually get into the content. So with all that being said, I want to let you all know this video is an in-depth view of the abortion process, what is a D&C, a D&E, a partial birth abortion, and an induction abortion. We're going to get into all four of those things. And as this video plays, I want you to think about what are people actually defending when it comes to abortion. All right. So with all that being said, let's get started.
I'm Dr. Norman McLean. I did practice within obstetrics and gynecology for nearly 40 years. I've done in the area of maybe 8,000 births. That would include maybe 2,000 cesarean sections. I have performed abortions early in my career. Over that time I would have certainly done between 100 and 200 terminations of pregnancy. So I know about the technique. Today I'm going to describe a first trimester surgical abortion, otherwise called a suction D&C, dilatation and curettage. This is the most frequently performed abortion technique and is typically performed between 5 and 13 weeks of pregnancy. After administering anesthesia, usually a sedative, the abortionist uses a speculum like this. This speculum is placed inside the vagina and then opened using the screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators like these, which increase in thickness and diameter, and the abortionist inserts them into the cervix progressively to dilate it, gaining access to the inside of the uterus where the baby resides. At this stage of pregnancy, the baby has a heartbeat, fingers, arms and legs, but its bones are still weak and fragile. After the cervix is dilated, the abortionist will insert a suction catheter similar to this. This is a clear plastic catheter, firm, which has a hole through which the contents of the uterus are sucked, and these contents are dragged down and into either a syringe of this nature, a plastic syringe which can exert considerable force, or connected to a vacuum extractor, a mechanical electrical vacuum extractor. The suction machine has a force 10 to 20 times more powerful than the usual household vacuum cleaner. And using this technique, the baby is rapidly torn apart by the force of the suction and squeezed through the tubing, down the suction tube into the syringe or vacuum machine. Following the baby, the placenta is sucked out of the womb. Because the procedure is blind, that is, the abortionist is simply feeling what he is doing within the womb. One of the common problems is getting everything out, so that it's not unusual for parts of the baby to remain within the womb and parts of the placenta, which feed the baby, remain within the womb. This can lead to ongoing bleeding and infection. And in an attempt to prevent this, the abortionist will use a curette to scrape the lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include damage to the organs, for example, perforation of the uterus or laceration of the cervix. Potentially, injury can occur to the intestines, the bladder, or nearby blood vessels. Hemorrhage and infection can occur, and in rare instances, even death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related injury to the cervix or uterus. I stopped doing abortions because I realized this is not right. This is not what I should be doing. This is not the medicine, the life-giving, healing medicine that I wanted to practice. And from that day, I stopped.
Okay. That was very telling. Very, very interesting, very graphic. I just don't understand why or how. Well, I do understand in some cases. I do understand when there is a reason for an abortion. Okay, so I'm not totally rigid in that aspect, because I do understand that some people become raped, or the woman's body is in trouble, or is some type of sickness or ailment or stillbirth or just whatever, and you have to abort the child. But someone who is healthy, the baby is healthy, and you decide to commit this act, I believe it is inhumane. We're going to move to the second trimester, which is called the D&E abortion, or which is better known as the dismemberment abortion. Okay, so as we before we speak too long or I get ahead of myself, we're going to move to this video and we're going to let it play, and I'm going to come back with my commentary.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters.
I just want to say real quick, this video and this part is very graphic. From this point forward, it gets progressively more graphic. So I just want to use that again as a disclaimer. So let's keep going.
With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and a 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.
The first thing that comes to my mind on the second trimester, out of everything that I could say, is all the damage that a woman takes to her body, or the potential damage she could take or receive to her body that is or potentially could be long lasting, permanent, lacerations, perforations of the uterus, infections, hemorrhaging, death. What are you defending, ma'am, sir? Whoever is a pro-abortion activist or person that believes these type of things are humane, or it's her body, her choice. What are you defending? Because in my mind, all it is unaccountability. Someone just does not want to be held accountable for their actions, because there are so many different alternatives to stop you from becoming pregnant. And then on top of that, if you don't already know, now people that support abortions want it to be on Medicaid, where they can get it on their insurance. They can get abortions on their insurance. Just outlandish. Okay, but anyway, let's just keep moving forward. This is the 3rd trimester abortion, called a partial birth abortion. We're going to let this video play, and I'm going to come back with my commentary.
The next thing we're going to talk about is what's called a partial birth abortion. If we can't get the nation and our legislature to understand what's really going on here, we're never going to have any kind of an impact. Partial birth abortion can be performed at any gestational age. Okay? We talked about Roe versus Wade and all the things that came into that. There are so many things that when you think, you can do this procedure if mom's health is in jeopardy, you think, well, I guess if we don't do this, mom dies, that means her health. Health is defined as physical, emotional, psychological, age, familial. So just not anything too young, too old, anxious, depressed. Any of these things can be considered health and how these procedures can be performed. But with a partial birth abortion, the baby is there from the inside and the baby is alive. All right? They will then use an instrument. They dilate the cervix. Sometimes it takes a couple of days to open up the cervix enough in order to deliver the baby. And this can be done at any gestational age. But what's done is then the baby's foot is grabbed up from the inside and it's brought back down. All right. So we're essentially delivering this baby breech. All right. And when the first foot is brought down, the baby is still alive. They then reach up and they'll deliver the second foot and the second leg. Now they have a good grip on the baby, and the baby's alive, and the baby's moving around. Then they'll put a little bit of traction on. They'll start to bring the baby down a little bit more. And as they're bringing the baby down more, the arms start to come into view. And they'll reach up with one finger. They'll grab the right arm, they'll sweep it down, and they'll deliver the right arm. Then they'll rotate the baby around, and they'll deliver the left arm. Now at this point, 90% of the baby is on the outside. You know, the baby has already completely left the womb and is beyond the cervix, and it's just the baby's head that's sitting there still in the vagina. Legally, the baby is not born yet. Alright, the baby hasn't taken its first breath. The baby's alive, moving, doing its thing while it's being held in the doctor's hand. And I use the term doctor really loosely. But the baby's being held right there. But what they need to do now is they need to, do the abortion procedure. They need to kill the baby. And the way they do that, it's one of the more common ways, is they'll use a pair of scissors like this. Now you're from your biology class. Remember the foramen magnum, that hole in the base of the skull where your spinal cord comes down from the brain into the back, into the spine? This scissor is then placed at the base of the baby's neck, the base of the skull, and is forced up into the baby's skull, into the baby's brain cavity. And then the scissor, is opened up just like that to expose that area. If this doesn't kill the baby just by doing that, then the thing they can do is they can then take a suction curette, place it up into the hole they just made, up into the baby's brain, and then turn the suction machine on. Just like it crushes a steel can, you can imagine what it does to the baby's brain up there on the inside. Once they've done that, and they've killed the baby, which now, of course, stops moving, then they'll deliver the rest of the baby, dead. But that's when you hear partial birth abortion. There's no way that part of the procedure, yes, there are some reasons where we need to deliver babies early. When moms are sick, and the only way we're going to get mom better is by delivering the babies early. But to deliver the legs, the belly, the chest, and both arms of this baby, and then kill the baby at that point, how does killing the baby at that last second protect the mom at all? It doesn't. It's just a way of being able to justify in somebody's head killing babies at any gestational age, whether it's the first trimester, the second trimester, or the third trimester. But that's what a partial birth abortion is. When it comes up in the news and it comes up, in the legislature, that's what's really going on. Just picture that. Babies that would do just fine. We have babies that do well at 23, 24, 25 weeks at our intensive care nursery, and we have great survivals. These are babies that are even further along than that. That all they need is just let the head come out, clamp the cord, cut the cord, let the baby go to the nursery. Okay? Those are first, second, and third trimester abortions.
Okay, y'all. What is the purpose of... there's different types of abortions. We're going to get into the induction abortion next if you're still with me here. I know this is graphic, but like you said, the baby's out of the womb, past the cervix, 90% out of the woman's body. All you got to do is just clip the cord and take the baby to the nursery. What is the point of sticking a pair of scissors in the back of the baby's head and sucking his brain out and then crushing his head like a Coke can? What is the purpose, fellas, ma'am, sir, gentlemen, ladies, whoever's listening to this? Can anyone give me a humane or any reason you can think of that is justified to end a child's life this way? Think of the people who do this every day, and do not lose an ounce of sleep. If they are not demons, they are definitely a different breed of person. But anyway, let's keep moving. The next part we're going to get into was called a induction abortion. It is also a third trimester abortion by the same guy, Dr. Anthony Levatino. Very interesting videos, very graphic videos. So I hope you're still with me here. But like I said, this is an induction abortion. So let's get into it.
25 weeks to term. My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a third trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix.
Okay, he at this point he just pretty much repeats the same thing he did at the end of the last video, so I just pause it there. What I want to say is 2 things, more than 2 things really, but when it comes to abortion and the definition abortion is used loosely and in the wrong tense, because when you seen the graphic of the lady sitting on the toilet and her body, when she had the baby and her body was aborting the baby, then that is an abortion, the natural expulsion of a fetus. If you look up the definition of abortion, you will see the first definition, or one of the 2 definitions that you will first see, is the natural expulsion of a fetus. Aborticide is when you actually go in and kill the fetus inside the womb. Look up the definition of aborticide, like homicide or suicide. Aborticide, it will tell you it is going in and physically killing the baby inside the womb. So there is no dispute that abortion is homicide. Abortion is murder. In any gestation age, it was a gestational age. Okay? So, my next video I'm going to show you is about a lady named Gina. And I'm going to show you and just watch the intenseness in her voice. Watch her eyes when she speaks about the unborn. Just listen to how nonchalant she speaks about the child, but then want to talk about women's rights on why they should be able to kill the child. Watch this.
People will still get abortions. If someone wants an abortion, needs an abortion, it will happen. But a lot of people will die. It's not going to be the unborn. It'll be living people taking their life because they'd rather not have a child.
And I'm going to leave it right there. Thanks for watching.